So good afternoon or good morning to everyone. This is our fifth topic for this semester, which is bioterrorism. And for the finals, this is our first topic and our third to the last topic before we have our final examination as we commence our MLSP subject. Okay, so I have already mentioned to you the different instances wherein bioterrorism was done in a certain country. For example, the anthrax attack in the US. Okay, and then this video discussion is done most especially for the Friday classes, since we have a lot of class suspensions because of holidays, certain holidays. So at least you have the time to go on with this discussion on your free time at the comfort of your homes. And on November 10, okay, that's Friday, okay, Friday right after our short vacation because of the um, All Saints Day. So on November 10, please prepare for a short quiz with regards to bioterrorism. So let's start with our discussion. So please bear with me if you will be listening to some of unnecessary noises. So because this is the disadvantage of online discussion because of unnecessary noises. Okay, so please bear with me. So let's start with our discussion with regards to bioterrorism. So our objectives for today is to discuss the basic concepts and impacts of bioterrorism in the society. So ano yung impact, ano yung nagiging cause of bioterrorism in the society, and also we'll be identifying what are the different categories of the bioterrorism agents. So binigay ko to as an assignment, as well as the selected bioterrorism agents, okay, for each category. And then also these bioterrorism agents can cause different kinds of diseases, not only to humans but also to livestock or yung mga alaga natin sa farm, for example, like cows, goats, chicken, okay? And also, what are the signs and symptoms if you're affected by these various bioterrorism agents, and how they are being transmitted from person to person, or from infected livestock to humans. Okay, so what is bioterrorism? So class, no, bioterrorism is also referred as biological attack. Okay, so ibig sabihin, class, this is an intentional release of biological agents. Intentional, ibig sabihin, sinasadya. Okay, so sinasadya nilang i-release yung biological agents which come in the form of pwedeng viruses. These biological agents can be viruses, can be bacteria, or yung toxins. Okay, so what is the purpose of this intentional release of biological agents? That is because the reason for having this bioterrorism is because these people or group of people wants to cause illness or death among people and also terrorize a civilian population. Okay, not just these bioterrorism agents, no, such as viruses, bacteria, or other germs, not just sicken or cause sickness to the people, but eventually it may also cause death among the people, and not just for people but also to our livestock. So I have mentioned a while ago ano tong mga livestock, okay? So yung mga carabaos, yung mga cows, yung mga goats, chicken, and also it can also affects the crops. So yung mga crops, most especially yung mga rice fields natin. So for example, no, a certain group of people wants to terrorize a certain country or location wherein yung source of income nila or source of employment is through farming. Okay, yung farming. So, nagfa-farm sila ng different kinds of crops or root crops. So, they will, for example, release some toxins that may destroy these crops. So, ang mangyayari nun is that it can cause hunger to that certain location. Kasi nga, wala nang food, wala nang source of food, wala na tong mga rice na to, wala na tayong palay, wala na tayong fruits or vegetables kasi nag-dry up na sila, na-destroy na sila because of these toxins. So, it may cause hunger or famine to the selected or the location where bioterrorism took place. Okay, so kaya nga, bioterrorism is also considered as a public health emergency. So what are the different classification of bioterrorism agents? Okay, so just like yung mga BSL cabinets natin, class, meron din tayong classification for bioterrorism agents. So the classification is based on the agent's ability to be disseminated. So ibig sabihin, kapag disseminated, how is it being transmitted from one person to another? So po pwede siyang in the form of aerosols, or po pwede siyang ma-disseminate because through contamination of food or water, or po pwedeng direct injection. For example, yung virus nasa syringe, directly injected siya sa human. Okay? Po pwede rin siya doon. Okay? And then also, the classification is also based on the mortality rate of the agent. Okay, yung mortality rate is yung ability of these bioterrorism agents to cause death to a person or a certain group of people. And then another factor to be considered to classify these agents is the agent's capability of causing public panic. Ito ba magkukos ba ng major panic sa buong mundo, sa certain location, sa certain region? And also, the classification is also based on the actions that are required for public health preparedness. So, what these bioterrorism agents, no, different classifications nga, no? So, magbe-base din tayo sa classification of these agents on the actions that we will do in order for us to prepare for this kind of catastrophe. Okay, so usually class, no, yung bioterrorism agents or bioterrorism are usually nasa nangyayari sa isang country, for example, and usually driven by political or ideological motives with the cause of causing fear, disruption, and harm to a certain population or sa mismong government nila. Okay, so let's move on with the categories and characteristics of bioterrorism agents. So first we have category A. For this category A, okay, this is the highest priority agents. These are agents which are considered as the highest priority. Okay, so these pathogens are rarely seen in the US, and since it can cause the highest priority among the agents, it can pose a risk to national security. Okay, so national security because it can be easily disseminated or transmitted from person to person. Mabilis siyang i-transmit from person to person. That's why it may cause a high mortality rate. Okay, mas malaki yung death rate. Okay, it may result in a high mortality rate and have the potential for major public health impact. Okay. So, and also, since it may cause a public health impact, kasi nga, mas mataas yung mortality rate niya, this can cause us, the public, to panic, and also this may cause social disruption. Okay, that's why for category A, bioterrorism agents, they require special action for public health preparedness. Kasi nga, highest priority agents sila, mas mabilis silang makakos ng death. That's why nagpapanik yung public. That's why kailangan natin i-prevent to by special actions for public health preparedness. Okay. And then for category B naman, okay, so kung highest priority si category A, okay, si category B naman, this is the second highest. Okay, so tandaan lang natin, no, yung A, yun yung highest category natin, and then si B yung second. Okay, and then since second lang siya, mas matindi pa rin si category B, kaya this is moderately easy to disseminate. Okay, moderately easy to disseminate and also result in moderate morbidity rates and low mortality rates. Kanina kay A, high yung mortality rates niya. For B, low lang yung mortality rate niya and also moderate yung morbidity rate. So ano yung ibig sabihin ng morbidity rate? Si morbidity is the state of being unhealthy. Okay, magiging sick ka lang, okay? Magiging unhealthy ka lang because of a particular disease or situation. Okay? Whereas, si mortality is the number of deaths that can occur in a population. Si morbidity, magkakasakit ka lang. This mortality is mamamatay ka. Okay, that's the difference between morbidity and mortality. And this one, for category B, it can only result in moderate morbidity rates, and compared to category A, low lang yung mortality rate niya. Okay? And this category B requires specific enhancement of the CDC's diagnostic capacity and enhanced disease surveillance. Kung si agent is kasama siya sa category B versus category A, mas nagkukos ng panic yung nasa category A. So let's proceed with category C. Okay? Kanina, si letter A, yung highest priority, B, yung second, and then for category C, this is the third highest priority. Okay? So pangatlo siya sa mga categories. So this include emerging pathogens that can be engineered. Kumbaga, engineered po pwedeng gawin lang ni human, okay, for mass dissemination. Kumbaga, itatransmit lang siya sa buong crowd ng tao, sa masa, in the future because of its availability. Okay? Mabilis lang din siyang i-produce and to transmit from one person to another. And also, it has the potential for high morbidity and mortality rates and major health impact. Okay? So, ibig sabihin, si category C have the potential for harm, okay, makakapag-cause pa rin siya ng harm, but are less likely to be used in bioterrorism attacks. So usually, ang ginagamit ng mga terrorists is either they use category A agents or category B. Kapag si category C kasi class, it might cause harm, pero hindi siya likely to be used for bioterrorism attacks. Okay, so they usually include emerging infectious diseases and pathogens that can be engineered or that can be produced for the intention to cause harm. So what are the examples of bioterrorism agents? And of course, yung diseases that these agents can cause to a person or to a livestock. Okay, so tingnan natin. Okay, si category B, kay category A, okay, category A, we have anthrax, yung kinwento ko before when we were discussing the fourth topic. Okay, anthrax. Under category A, we have anthrax, botulism, and plague. Okay, so dito sa baba, this is the causative agent. Okay, this is the causative agent of this particular disease. For example, si anthrax, this is the disease caused by Bacillus anthracis. Okay, si botulism is caused by Clostridium botulinum toxin, and then si plague is caused by the organism Yersinia pestis. Okay? So yung pinaka well-known dito is anthrax, okay? Because the 2001 anthrax attacks in the United States, in which, di ba, I have mentioned previously that letters which contains the anthrax spores were mailed to various individuals and media outlets, and it is one of the most well-known instances of bioterrorism. Okay, so because of this anthrax attack in 2001, this resulted in several deaths and widespread fear. So kumbaga, nangyari lang siya sa US, pero because of this, it also affected other countries kasi parang naging paranoid na tayo. Now, we might also be attacked by this certain bioterrorism. So let's start with anthrax. Okay, so anthrax class, as I have mentioned a while ago, yung causative agent niya is the bacteria which is called Bacillus anthracis. Okay, so this Bacillus anthracis is a spore-forming bacteria. This is a spore-forming bacteria. Okay. Kaya nga class, during the 2001 bioterrorism attacks for anthrax, ang ginawa nila, yung letters, nilagyan nila ng spores of the Bacillus anthracis. Okay, so its mode of transmission, okay, its transmission can be through direct contact with infected animals. Ibig sabihin, when an infected animal, for example, a dog is infected with anthrax and hinawakan nyo siya, okay, kasi pet nyo siya, so that is direct contact, and pag meron siyang anthrax, it can be transmitted to you. Okay? And also another mode of transmission is occupational exposure to infected animal products. Okay. So kapag occupational exposure, usually yung mga affected dito are farmers. Okay? Example then are yung mga veterinarians natin. Okay, so they are, if a farmer or a veterinarian is exposed to an infected animal product, the anthrax can be transmitted to him or her. Okay, so kasi class, si anthrax is usually a disease of herbivorous mammals. Okay, so herbivorous mammals, example are cattle and sheep. Okay, but also hindi ibig sabihin that this is a disease of herbivorous mammals, it can also infect humans. Sabi ko nga, farmers and those that are tending animals. Okay, yung mga nag-aalaga ng mga animals. Okay. So, anthrax class, it has 3 primary forms in humans. Kapag na-infect si human, meron siyang 3 primary forms, and this depends on how the infection enters the body. Okay? Kapag na-infect ni anthrax, na-infect ng anthrax si humans, pwede siyang, it may take 3 primary forms sa humans, okay? Which depends on how the infection enters the body. We have cutaneous, inhalation, and gastrointestinal anthrax. Ito siya. So these are, kapag na-infect si human, okay, the anthrax can be of these types. Okay, we have cutaneous, we have inhalation, and we have gastrointestinal. Okay, so based from this, makikita na ninyo siya on how the infection may enter the body. Okay, so let's proceed with the first type. Okay, dito sa first type of anthrax, so usually, ito siya. Okay, so kapag cutaneous anthrax, okay, this is the common form of the disease in humans. This is the common form of the disease in human. Okay, so this is acquired, sabi ko nga, di ba, si anthrax, Bacillus anthracis is a spore former bacteria. So, the cutaneous anthrax is acquired by spore penetration through skin cuts. Okay, proceed tayo dito. Okay, sorry. Okay, cutaneous. Okay, so this is acquired by spore penetration through skin cuts. Okay, nakat yung skin mo, magpe-penetrate yung spore inside, and it may cause cutaneous anthrax. Okay, pwede rin siyang kapag nagasgasan kayo through abrasion or insect bites. Kinagat ka ng mosquito which is infected by anthrax. So, papasok siya through the cutaneous part, through the skin. That's why, ang magiging type of anthrax mo is cutaneous anthrax. Okay, so this is manifested by the appearance of black scars. Okay, ito yun. Okay, this is manifested by the appearance of black scars. Ito yung spelling. Okay. Scars. Okay. So, scars are depressed black necrotic central area which are usually 1 to 3 centimeters in diameter. 1 to 3 centimeters in diameter. Okay? So, ang pinaka-manifestation of cutaneous anthrax is by the appearance of scars, which are depressed black necrotic central area, which are usually 1 to 3 centimeters in diameter. Okay. So, another one is inhalation. Okay, inhalation or what we call as pulmonary anthrax. Okay, inhalation or pulmonary anthrax. Okay, so pulmonary anthrax is the most severe. This is the most severe, and since most severe siya, it is the deadly form of the disease. This is the deadly form of anthrax, the pulmonary anthrax. Okay. Another name for pulmonary anthrax is the respiratory anthrax. Respiratory anthrax. Okay. And also another name aside from pulmonary anthrax, aside from respiratory anthrax, this is also called as wool sorter's disease. Wool sorter's disease. Okay. So this is the wool sorter's disease. Okay. So paano nangyayari? Nagkakaroon ng respiratory or pulmonary anthrax or wool sorter's disease. This occurs when the anthrax spores are inhaled, kaya nga through inhalation. Okay? Usually as a result of exposure to contaminated animals or bioterrorism. For example, the sheep, farmer ka, nag-aalaga ka ng sheep. Si sheep is contaminated with the spores. So, na-inhale mo siya. Okay? So, magkakaroon ka ng pulmonary or anthrax or respiratory anthrax, or another name pa rin is the wool sorter's disease. Okay? So, ang manifestation nito, ang symptoms niya is para kang may flu. Okay? So, flu-like signs and symptoms. And usually, these symptoms initially resemble a common cold. So, parang akala mo lang meron ka lang sipon, but can progress rapidly to severe breathing difficulties, shock, and ultimately death if not treated promptly with antibiotics. Kumbaga, natitreat naman yung anthrax class, pero it should be treated promptly with antibiotics, and if not, it can cause death. Kasi kumbaga class, mag-uumpisa muna siya sa flu-like symptoms, para ka lang may common colds, but mabilis siyang magpa-progress to severe breathing difficulties. Mahihirapan kang huminga, and then afterwards po pwede siyang mag-cause ng death if not treated properly with antibiotics. Okay? So we also have the gastrointestinal. Okay? So this one is acquired through the ingestion of spores. Okay? Through the ingestion of spores. Na-ingest niya, nakain niya yung spores. Itong kay inhalation, okay, naamoy niya or na-inhale niya, for gastrointestinal is ingestion of spores or toxins that are contaminated with anthrax. Ano yon? Ano yung pwedeng mai-ingest natin that are usually contaminated? Yung meat, okay? Yung meat. Yung contaminated animal, ginawa natin siyang meat, kakainin natin, pwede siyang mag-cause ng gastrointestinal anthrax. Okay. So, yung symptoms niya may include nausea, vomiting, and of course, syempre, nakain natin, meron tayong tendency to have abdominal pains and magkakaroon tayo ng severe diarrhea. Okay. Gastrointestinal anthrax is the form of anthrax that can be fatal when not treated early with antibiotics. Kapag hindi siya maagang na-treat with antibiotics, this can be life-threatening or this can cause death. Okay, this can be fatal. So let's proceed with the next one. We have the plague. Okay, so yung causative agent niya is Yersinia pestis. Okay, ito yung bacteria which can cause plague. Okay, other name for plague. What is the other name for plague? This is also called as Black Death. Okay? Also called as Black Death. And during the 14th century, andito na yung plague. Tawag nga nila dyan is Black Death. So during the 14th century, this resulted in millions of deaths in Europe. Okay? So yung mode of transmission niya is bites of infected fleas. Okay? Bites of infected fleas. And also, just like kay anthrax, meron din siyang inhalation. It can also be transmitted through inhalation of infected respiratory droplets. Okay, for example, meron akong plague, nag-sneeze ako, respiratory droplets yon, and then yung katabi ko na inhale niya, po pwede siyang maka-acquire ng plague or Black Death. Okay, so what are the types of plague? Okay, we have bubonic plague. Ito, si bubonic plague. Bubonic plague and the pneumonic plague. Okay, so si bubonic plague, this is the most common. Okay? Most common type of plague is the bubonic plague. Okay, so this occurs within a week after being bitten by an infected flea. Okay, so this infected flea usually comes from small mammals such as rats. For example, si rat, meron siyang infected flea. Okay, tapos bigla kanyang kinagat. Okay, so after 1 week, it may manifest within a week yung bubonic plague. Okay, so si bubonic plague, yung symptoms niya is by the appearance of this one. Okay, so anong tawag ito? Anong tawag dito? These are yung mga buboes. Kaya siya tinawag na bubonic plague. Okay? These are swollen, painful lymph nodes. Okay? These buboes are bubonic plague is manifested by buboes. So ano si buboes? These are swollen and painful lymph nodes that can be found on the groin, armpit, at saka sa neck. And then also po pwede rin siya sa ibang parts. Pero usually, this can be seen sa groin, sa armpit, and then sa neck. Okay. So kapag may bubonic plague, you can have the sudden fever, bigla ka nalang lalagnatin, and then you will also have chills and sudden weakness. Okay. And it's just like plague, if untreated, bubonic plague can spread to the bloodstream. Kapag hindi siya na-treat, si bubonic plague can spread to the bloodstream and may cause severe illness. Okay. So next type is the pneumonic plague. Okay. So pneumonic plague occurs secondary to bubonic plague when organism reproduce in the bloodstream and respiratory tract. Kumbaga, mauuna muna si bubonic plague and then afterwards, it may progress to pneumonic plague. When the organism, ano ba yung organism or the causative agent of plague, we have the Yersinia pestis. Kapag si Yersinia pestis nag-reproduce or dumami na siya sa bloodstream and sa respiratory tract natin. Okay, so this occurs pneumonic, no? So pneumonic, it affects our lungs, okay? And also affects the bloodstream. And also since lungs, yung respiratory tract, okay? So it occurs under crowded conditions when contaminated respiratory droplets expelled by infected persons are directly inhaled by another person. Okay, so pneumonic plague is the most virulent and can be transmitted from person to person through respiratory droplets. So yung symptoms niya, usually, the person has a high fever, meron din siyang weakness, and a rapidly developing pneumonia. Kaya siya pneumonic plague. Yun yung tatandaan natin, no? High fever, weakness, and a rapidly developing pneumonia. Nagkakaroon ng pneumonia yung person, which often leads to respiratory failure. Okay, so pneumonic plague, since natatransmit nga siyang mabilis because of respiratory droplets, no? Kaya this pneumonic plague is the most contagious form and can rapidly be fatal without prompt antibiotic treatment. Okay, mas nakakahawa siya and mas mabilis siyang makamatay kahit na kahit na na-treat siya immediately with antibiotics. Okay, so this is the most contagious and most fatal. Mas mabilis siyang makamatay. Okay? Next one, another category A, we have the smallpox. Smallpox is caused by variola major. Tularemia is caused by Francisella tularensis. And also we have the viral hemorrhagic fever. Okay, So you have already heard about smallpox, which caused also millions of death, okay? Which caused millions of death before, di ba? And this is highly contagious. Okay, this is caused by the variola virus, particularly the variola major virus. This is highly contagious, mas mabilis siyang makahawa, and it is manifested by distinctive rash of raised fluid-like blisters. Meron kang fluid-like blisters. Yung blisters, meron siyang fluid sa loob that can cover the entire body and often lead to severe illness, scarring, magkakaroon ng peklat, and eventually death. Kung natatandaan nyo, class, yung manifestation nung chickenpox, katulad siya ni smallpox. Okay? Si chickenpox, yung itsura nung merong chickenpox, kung nagka-chickenpox na kayo, so alam nyo na yung itsura nun. Di ba magkakaroon kayo ng rashes, tapos naka-raise siyang ganyan, tapos para siyang blisters, okay? Na para siyang blisters na may tubig-tubig sa loob. Okay? So this is the most devastating disease in human history, and because this is responsible for numerous epidemics. So nagkaroon na to ng epidemic before, which caused millions of death before it was declared eradicated in 1980. Eradicated, ibig sabihin, parang kay COVID, no, unti-unti na-eradicate na siya, nawawala na siya. Okay? So this is, smallpox is responsible for numerous epidemics and deaths before it was declared eradicated in 1980 through a global vaccination. Kaya na-eradicate yan because of the vaccine. Okay? Nagpa-vaccine na yung mga tao, kaya it was totally eradicated. Okay, so this is usually, since kaya nga siya naging highly contagious because this can be acquired because of respiratory droplets. Ibig sabihin, for example, nag-sneeze ako, nag-cough ako, meron akong smallpox, yung naka-inhale nun, okay, na-expose doon, pwede siyang magkaroon ng smallpox. Okay? So, this smallpox was fully eradicated through vaccines. Okay? So, yung last naturally occurring case was reported in 1977. Yung last case so far is 1977. Okay? And in 1980, according to WHO, the disease was finally eradicated because yung mga tao nagpa-vaccine na sila. Okay? And then next one we have tularemia, which is caused by the organism Francisella tularensis. Okay, tularemia is also called rabbit fever. Okay, also known as rabbit fever. Okay, and also deer fly fever. Ito yung mga other names niya, no? Deer fly fever. And then, pwede rin siyang lemming fever. Itong sinusulat ko, class, ito yung mga different names niya. Pwede rin siyang tawagin. Okay? Also known as water rat fever. Okay, water rat fever. Or, sorry, water rat trappers fever. Okay, ulitin natin, no? Tularemia, caused by Francisella tularensis, is also known as rabbit fever, also known as deer fly fever, lemming fever, or water rat trappers fever. Okay. So, kung napapansin nyo, anong pinaka-common dyan? Rat. Okay, meron siyang rat. Okay. Or meron din siyang rabbit, meron din siyang deer fly, or lemming. Because tularemia is a disease of rodents. Okay, disease of rodents. Kaya siya tinawag na rabbit fever, deer fly fever, lemming, and water rat trappers fever. Okay, so this is acquired by humans by ingestion, inhalation, arthropod bites. Ibig sabihin through ticks and flies. Merong tick si lemming, okay, which is a rodent that is infected with tularemia. Kinagat ka, so matatransmit sa'yo yung tularemia. Okay? So aside from acquired by ingestion, inhalation, through arthropod bites, it may also be transmitted by contact with contaminated soil or water. Okay? For example, yung infected rodent, nagpoops siya sa soil or sa water. Ininom ni human yon or hinawakan ni human yung soil and then hindi siya nag-wash properly, nilagay niya yung kamay niya sa bibig niya, so that can be ingested. Okay? Pwede kang tamaan ng tularemia. Okay? So next one are the viral hemorrhagic fevers. So example of viral hemorrhagic fever is Ebola. Okay? Example is Ebola. Okay? Example of viral hemorrhagic fever is Ebola, which infects wild animals. So, since it can infect wild animals, so kaya nagkakaroon na transmit kay human because of direct contact with blood, secretions, or body fluids. Okay. So, for example, si human, may contact siya with wild animals, so na-infect siya. Okay? It may be transmitted to another human when through direct contact with blood, secretions such as yung mga saliva, ganon, body fluids of infected persons. Okay? So during that time, yung mortality rate of Ebola was 25 to 90%. Okay, so usually yung na-affect dito are the Central and West African countries and was first identified in 1976. Si Ebola to. Okay? Ebola was first identified in 1976 in the Democratic Republic of Congo. Okay? Okay, lagyan natin dito. Okay? It was first identified in 1976 in the Democratic Republic of Congo, and now the Democratic Republic of Congo is known as Zaire. Okay, ito na yung new name ng Democratic Republic of Congo. Okay. So the largest recorded outbreak of Ebola happened in West Africa between 2014 and 2016. Okay, next tayo. Okay, another category A, we have filoviruses. Okay, so another example then, no? This one. Okay, balikan natin to. Okay, yan. So example of filoviruses, ito yung disease niya. Okay, ito naman nagkabaligtad siya, class, no? Ebola is the disease, Marburg is a disease, okay, which is caused by filoviruses. Okay. And then also Lassa virus, Machupovirus, these are viruses, these are the conditions or the diseases which are caused by arena viruses. Okay. Okay, so let's proceed with category B. So what are the bioterrorism agents under category B? We have brucellosis, which is caused by the Brucella species, the epsilon toxin, which can be found or which is caused by Clostridium perfringens, and the food contaminants. So food contaminants, usually nagkakaroon ng food poisoning because of these food contaminants. So what are these food contaminants? We have the Salmonella species, we have the Escherichia coli 157, age 7. Okay? Pag tinanong class, no, wag lang sasagot ng Escherichia. Dapat kumpleto tayo. Escherichia coli 017 or 0157 age 7. Okay? Kung paano siya nakita dito. Okay? And also another food contaminant is the Shigella. Okay? So si brucellosis is a zoonotic disease. Okay? Zoonotic disease, ibig sabihin, it can be transmitted to humans through direct contact with infected animals or their products. Okay, this is a zoonotic. This is zoonotic. Okay, this is a zoonotic disease. Ibig sabihin, transmitted to humans through direct contact with infected animals or their products. Products, yung mga meat nila, yung mga milk nila. Okay, kaya sabi dito, their products including unpasteurized milk or cheese kasi nanggagaling yon sa animals, and then also because of contaminated air and ingestion of contaminated food or water. Okay, so usually ang na-expose dito are usually farmers, veterinarians, and laboratory workers. Okay, next one we have the epsilon toxin, which is caused by Clostridium perfringens. Okay, this infects the GI tract of humans and animals. Okay, gastrointestinal tracts of humans and animals. It is also classified, epsilon toxin is classified as a bacterial exotoxin. Okay, again, epsilon toxin affects the GI tract of humans and animals. Okay, the epsilon toxin is also uh, classified as a bacterial exotoxin. So, ano yung exotoxin? Ano tong exotoxin na to? Exotoxins are toxins or lason, okay, which are released by the bacteria into their environment. Okay, so epsilon toxin is produced by certain strains of, again, the Clostridium perfringens, specifically those belonging to type B and D. Type B and D. Okay? And this epsilon toxin affects the central nervous system. So si food contaminants class, food contaminants, proceed tayo sa next slide, no? Sa food contaminants, ito siya. Okay, sabi kanina, di ba? It can caused by salmonella. Okay? Yung disease is called as salmonellosis, which is caused by salmonella. Okay. So this one, yung certain or particular or specific species of salmonella which can cause salmonellosis is Salmonella enterica. Enterica pala. Enterica. Letter T. Enterica. Okay, the causative agent is Salmonella. Specifically, the Salmonella enterica. Yung disease is salmonellosis. Okay, so this is food poisoning. Food poisoning. Okay, so this is the food poisoning. And usually the mode of transmission is of course by consumption of contaminated food of animal origin. Okay, so kaya tayo nagkakaroon ng na-transmit yung salmonellosis is because of handling and eating raw or undercooked poultry, meat, or dairy products. Okay, so pag kinain natin, improper handling and also hindi siya luto ng maayos, it can cause food poisoning. Okay, or what we call as salmonellosis. Okay, so yung symptoms niya, since nakain natin siya, okay, so meron siyang abdominal pain, diarrhea, vomiting, and nausea, and also fever. So what can we do to be able to prevent this from happening? Okay, from having salmonellosis, we can prevent this one by these practices. We have to ensure that the food that we eat is properly cooked. Okay, and also we only have to drink pasteurized or boiled milk. Okay, wag yung directly pagkakuha dun sa cow, for example, iinumin nyo na siya. Yun yung tawag na unpasteurized milk. Okay? So we have, kung pwede naman natin siyang inumin, pero kailangan natin siyang i-pasteurize or ibig sabihin, i-boil muna natin siya before we will be drinking that particular milk. Okay. And then also class, this illness typically begins 6 to 72 hours after consuming contaminated food or water. Okay, so mild lang siya class, okay, and resolve without treatment within a few days. Pwede siyang mag-resolve maayos, pwede kayong maging maayos without undergoing treatment. Okay, but in severe cases, because of nagkakaroon ng diarrhea kasi and vomiting. So, syempre kapag ganyan, pwede tayong magkaroon ng dehydration. Kaya siya nagiging severe because of dehydration. Okay? And then the diagnosis can be seen o pwede nating ma-diagnose if a person has salmonellosis through a stool sample. Okay? Yung poops natin, ipapatest lang natin. Okay? Okay, next one is the waterborne illness. Okay, the waterborne illness is called as cholera, which is ito yung causative agent niya, si Vibrio cholerae. Okay, so the mode of transmission is through ingestion of contaminated water. Okay, so usually class, this one, kaya siya merong ingested of contamination water is because of poor sanitation. Okay? Poor sanitation, unhygienic practices, pagkatapos mo yung nag-poops, hindi ka nag-wash properly with your hands, and then bigla kang nag-prepare ng food, and then kinuk mo siya, kumain yung kasama mo sa bahay. So, pwede kayong magkaroon ng cholera. Pwedeng magkaroon ng cholera yung kasama mo. Okay? And then also, since poor sanitation, they usually this cholera usually occurs in places wherein there is only a limited access to clean water. Okay? Yung symptoms niya, meron siyang acute watery diarrhea and may cause severe dehydration. So what are the preventive practices in order for us to prevent cholera? We have to drink safe water and clean water, of course, and observe good hygiene practices. Okay, so again class, since yung symptoms niya is the onset of acute diarrhea or watery diarrhea, okay, and severe dehydration, so nagkakaroon ng diarrhea which may cause dehydration. Kaya siya nagkakaroon ng severe death because of dehydration, because there is loss of many fluid and electrolytes which may cause death and shock. Next one we have category B. Again, we have the glanders caused by Pseudomonas malae or Pseudomonas, or again, glanders is caused by Pseudomonas malae, or it may also pwede rin siyang Burkholderia malae. Okay, again, glanders is a disease that is caused by Pseudomonas malae or Burkholderia malae. Okay, this glanders is the disease of horses, mules, and donkeys. Okay, glanders. Disease siya ng mga horses, donkey, and mule. Mga magkakatulad tong mga to, di ba? Okay, and usually rarely lang sa humans. Okay, sa mga horses, it is manifested by nasal discharge, tapos nagka-cough din yung mga horses, nagkaka-fever din, and the presence of swollen lymph nodes. And then kapag na infect naman si humans, okay, the human may have skin ulcers, may also experience fever and respiratory symptoms, and also just like the horses, magkakaroon din siya ng swelling of lymph nodes. Okay, so this is often fatal sa mga animals because this is very difficult to treat pagdating sa animals. So kaya siya nagiging bioterrorism, baka this time hindi tao, hindi humans yung kanilang target, but the horses, donkeys, and mules. Okay, kasi nga this is very difficult to treat in animals, kaya nga ang daming namamatay because this is very difficult to treat. Okay, so next one we have melioidosis, which is caused by Pseudomonas pseudomalae or Burkholderia pseudomalae. Okay, so what is melioidosis? So this disease is transmitted through direct contact with contaminated soil and water, and also by drinking and consuming food and water that is contaminated. Okay, so it may cause severe infections because it is asymptomatic. Ibig sabihin, kapag asymptomatic, wala kang makikitang symptoms. Kaya usually, yung infections nagiging severe. So what are the manifestations kapag severe na siya? So makikita mo na lang siya kapag severe na yung infection mo. Hindi mo alam na infected ka na, manifest lang siya kapag severe na yung infection mo. And these manifestations are pneumonia, meron ka ring abscess sa lungs, nagkakaroon ng nana sa lungs, also in the liver, spleen, and the skin, and also eventually it may cause sepsis and death. Okay, so contaminated soil and water. Okay, and then we have psittacosis caused by Chlamydia psittaci. Okay, this disease is also called avian chlamydiosis or ornithosis. Susulat natin, no? Also called, this one, also called as, ito na lang, avian chlamydiosis. Chlamydiosis, also called as avian chlamydiosis or ornithosis. Ornithosis. Okay. So this is zoonotic. Ibig sabihin, from birds. Kaya nga, ito avian. Okay. Psittacosis is also known as avian chlamydiosis or avian ornithosis. Okay, disease comes from the birds such as parrots, pigeons, and poultry, mga chicken. Okay, so nagkakaroon ng psittacosis because of inhalation of bird droppings. Naamoy, na-inhale natin yung poops ng birds, and also inhalation yung mga feathers na maliliit, okay, and also respiratory secretions from birds. So talaga ang cause of infection is through the birds. Okay, nagkakaroon na infection because ang pinaka-source natin are the birds. Okay, so manifested by cough, fever, headache, chest pain, difficulty in breathing. There is also confusion, and kapag severe na yung disease, magkakaroon na tayo ng organ failure. Okay. Okay, next one is the Q fever, which is caused by Coxiella burnetii. The resin toxin caused by Ricinus communis. Ricinus communis is also called as castor beans. Okay, in layman's term, Ricinus communis is castor beans, and also staphylococcal enterotoxin B. Okay, so let's start with Q fever. Si Q fever naman is also a zoonotic. Ibig sabihin, caused by cattle, sheep, and goats. Okay, yung source of infection natin are these cattle, sheep, or goats. Kaya nga, it can be transmitted to humans if the human consume unpasteurized dairy products. So, yung dairy products nila, milk, cheese, okay, coming from this infected animal. So, pag nag-consume tayo ng dairy products which are unpasteurized, this can be transmitted to humans. So, usually, ang symptoms niya, there is the presence of hepatitis and also endocarditis. Kapag endocarditis class, this is the inflammation of the heart. Next one is the resin toxin. Okay, since toxin siya, so ibig sabihin lason, no? This is a highly toxic protein from the seeds of castor beans. Okay, a highly toxic protein from the seeds of castor bean plant, which is the Ricinus communis. So this is the most poisonous and naturally occurring substances ever known. So this is the most poisonous, yung castor bean plant. Okay, so this is also considered as a potent cytotoxin. Okay, potent cytotoxin. Cytotoxin, meaning it can kill cells by inhibiting protein synthesis. Okay, so ibig sabihin class din, no? So since this is considered as most poisonous, a tiny amount of pure toxin can be deadly if ingested, inhaled, or kapag na-inhale natin yung pure toxin, kahit super konti lang, pwede siyang maging fatal because this is the most poisonous and highly toxic protein. Okay, so kapag na-ingest natin, we may experience severe gastrointestinal symptoms, and kapag na-inhale natin, it may cause respiratory distress. And yung iba class, ini-inject ito kapag sa bioterrorism, no? Kapag na-inject naman to, it may cause systemic poisoning. Okay? Systemic poisoning. Okay? And then next one is the staphylococcal enterotoxin B. Okay, these are the certain strains of Staphylococcus aureus which cause food poisoning when inhaled. Kapag na-inhale siya, okay, pwede siyang mag-cause ng food poisoning kahit or rather, aside from being inhaled, no, pwede rin siyang mag-cause ng food poisoning. Okay, sa Staphylococcal enterotoxin B, these are certain strains of Staphylococcus aureus. Okay, can be transmitted through inhalation, and also transmitted, pwede siyang mag-cause ng sickness or death kasi pwedeng ma-poison ka. Kapag kunwari, yung food nilagyan ng Staphylococcal enterotoxin B, okay, or infected with certain strains of SRUs, which is the staphylococcal enterotoxin B, pwede siyang mag-cause ng food poisoning. Okay, another category B is the typhus fever caused by Rickettsia prowazekii, and also pwede rin siyang viral encephalitis caused by alpha viruses. So what are the examples of alpha viruses? We have Venezuelan equine encephalitis, Eastern equine encephalitis, and Western equine encephalitis. Marami sila. Okay? And also the water safety threats such as the Vibrio cholerae, yung kanina, no, yung sa waterborne, and also the organism which can also cause threat in water safety is the Cryptosporidium parvum. Okay, so this yung typhus fever caused by Rickettsia prowazekii has two primary forms. We have epidemic and murine. Okay, two forms of typhus fever. We have epidemic and murine. Si epidemic naman, is caused by lisa. Okay, yung mga laos natin. Okay. And then also epidemic is also caused by Rickettsia prowazekii, which is the bites of infected body lice. Okay. So kumbaga na tatransmit siya sa person because of the lisa, yung body lice, yung infected body lice. Yung lice na yon is infected with Rickettsia prowazekii. So kapag kinagat ka nun, okay, pwede kang magkaroon ng typhus fever. Or also, kapag na-inhale daw yung poops ng mga lice, or kapag kinrush yung lice, okay, pag kinrush it into small pieces yung lice and then biglang na-inhale the person, pwede siyang magkaroon ng epidemic typhus fever. Okay. And then, susulat natin dito, no? Crushed lice. Crushed lice. Or pwede siyang, kapag inhalation, na-inhale daw natin yung poops ng lice or lisa, no? Poops, feces. Okay. And then another type of another form of typhus fever is the murine typhus fever. Okay, this is caused by Rickettsia typhi. Wala yan. Okay. So this is caused by Rickettsia typhi, which can be found in fleas from rats. Okay. So class, no, si typhus fever was used during World War I and during the Russian Civil War. So ginamit na to for bioterrorism during the World War I and during the Russian Civil War. Okay. And then next one, we have the viral encephalitis. So viral encephalitis, there is, okay, this one. There is the inflammation of the brain tissue. Okay, namamaga yung brain tissue. Yun yung viral encephalitis. Okay? And then next one, we have the water safety threats. For example, the Cryptosporidium parvum. Okay? This can cause diarrhea. Okay? This is the most common waterborne disease. Most common. Okay. Okay. The most common waterborne disease is caused by Cryptosporidium parvum, and tawag natin doon is ito yung radiosis. Okay? So again class, no? The organism Cryptosporidium parvum can cause water safety threats. Okay? So Cryptosporidium parvum can cause cryptosporidiosis, which is a diarrheal disease. So, ibig sabihin, when you're infected with Cryptosporidium parvo, magkakaroon ka ng diarrhea. Okay? And that is called cryptosporidiosis. And this is the most common waterborne disease. Okay? So these are the references that were used for this discussion. So next meeting class on November 10, that is on Friday, our next meeting, please prepare for a short quiz about this discussion. Okay, so please enjoy your vacation and thank you so much. Bye-bye.